Hi, I'm Judy. I'm the Director of Education with the Institute of Somatic Therapy, and today I'm going to be demonstrating some techniques you can use if you have a client that has sciatic pain. My client today is Crystal. She's 30 weeks pregnant, and we are going to use the side-lying position system from Oakworks. So if you want to come get on the table for me. If your client is having sciatic pain, it's most often caused by piriformis syndrome. So you would feel in your client from between the sacrum and the greater trochanter about halfway. If she's having tenderness here, that would be an indication that the sciatic pain is coming from the piriformis muscle, putting pressure on the sciatic nerve. There's a functional test you can do for this. If you have your client straighten her leg and lift it to about 20 degrees, if her foot tends to rotate towards the ceiling, that would be an indication that her piriformis muscle is tight. If you suspect that your client is having piriformis syndrome, as you're doing massage on the rest of the body, you can have some heat on it. I'm going to raise the table up here. I'm using the Oakworks table lift system. So I've put the portable table on top of the lift. You can bring her to whatever height is comfortable for me. Then stretches that we can do, you can bend the knee and lift the foot. That's going to cause a medial rotation of the femur, which is going to stretch the piriformis muscle. You can also do some static compression into the spot. You can use your elbow. If you prefer, you can use a loose fist. Neuromuscular work that you can do is you can use a reciprocal inhibition or a proprioceptive release. So what you would have is the client is, again, kind of the same position we were doing with the lift earlier, but we're going to have some resistance. So Crystal, if you'll lift your foot against my hand, use about 10% of your strength, and release. And we can do the opposite. If you'll push your foot into my hand and release. Those are all very passive techniques you can do. For deep tissue massage, you want to make sure that your pressure is going towards the inguinal ligaments because that's the direction of lymphatic flow. I like to start with some passes with thumb over thumb stroke because I can feel the muscle better with my thumbs. But once I've gotten through, kind of warmed up the area, because we're also working through the gluteus maximus, so we want to warm up the area, then I'll start making a series of passes using my fist or forearm or even elbow. And I'll just make a series of passes, again moving towards the inguinal crease along this direction, so you're covering all the area between the greater trochanter and the sacrum. If you're going to be working with a lot of pregnant clients, we do recommend that you get certification training in pregnancy massage. The Institute of Somatic Therapy does offer certification training for pregnancy massage and labor and delivery support.